Now let's look at the one and only tool that is used during clinical placement for physiotherapy students in Canada. The Canadian Physiotherapy Assessment of Clinical Performance, known as the ACP, is a qualitative report reviewed at midterm and as a final evaluation with the physiotherapy student. The students are encouraged to complete that same assessment tool prior to the midterm and prior to the final review to encourage self-reflection and discussion. Faculty training is offered by the Canadian Physiotherapy Alliance in order to use the assessment tool properly and effectively. As concluded by Mori and her collaborators in 2016, the ACP is a reliable, valid, and practical measure to assess and describe the PT students' behaviors as observed during clinical education relative to what is expected of an entry-level physiotherapist. As stated previously, it is important that the assessment tool, in this case the ACP, match the key competencies of the profession, the physiotherapist's role here. The ACP assesses professionalism, communicational and interpersonal skills, collaboration within an interdisciplinary team, treatment implementation, patient safety and patient-centered care, scholarly practitioner such as ongoing learning, manager, time management, caseload management, resources, and prioritizing. Let's look at its strength. It is easy and simple to use. It includes a clear description of desired learning outcomes and clinical competencies required to pass. It encourages self-reflection of the physiotherapy students, and most importantly, it is a validated and reliable tool. As for its weaknesses, it is a long 9-page report, and some students report feeling discouraged with the rating scaled used. For example, a student in a third out of 6 clinical placement cannot obtain higher than an intermediate performance as per safe caseload requirements. Therefore, visually, it looks like they've obtained a 5 out of 10, a 50% mark. But technically, according to the clinical placement objectives, it actually represents a successful placement, thus 100%. It is very important that the rating scale must be carefully reviewed with the student prior to every evaluation. And unfortunately, it does contain summative endpoints that generates a pass or fail grade.